Today we are discussing cardiovascular disease, how to prevent it, and warning signs. A few points that we will talk about are learning the basic function of the heart, understanding cardiovascular disease, identifying, minimizing risk factors, learning about normal ranges, and understanding warning signs. The heart and its structure. The heart is located in the middle of the chest. It is part of the circulatory system. The circulatory system is made up of vessels that carry blood throughout the heart. Vessels are long, hollow tubes of tissue, much like coffee stirring sticks. Blood is carried to and from the heart. How the heart works. Parts of the heart. Two upper chambers, the right atrium and the left atrium, receive blood. The two lower chambers, the right ventricle and the left ventricle, pump blood. You can feel your heartbeat by taking your pulse either on your wrist or on the side of your neck. The blood flow. The blood flow occurs simultaneously through both the right and left side of the heart in a specific pattern. First, deoxygenated blood returns from the body to the right atrium, while oxygenated blood from the lungs go to the left atrium. Blood is then pumped through the atrioventricular, also known as AV valves, to the right and left ventricles. The AV valve closes when the ventricles are full. The ventricles then contract to pump blood throughout the semilunar valves to the lungs by the right ventricle and to the body by the left ventricle. Now I'll be turning it over to Kristen.
Cardiovascular disease, cardio meaning heart and vascular meaning vessels, includes disease of the heart in the blood vessels in one's entire body. It does not include only one disease, but a group of different disorders. Some people are born with heart disease, however, the majority of us develop it over time. Cardiovascular disease shares certain risk factors we will be discussing later in the presentation. Types of cardiovascular disease are atherosclerosis, which is a condition where plaque buildup causes the hardening of the arteries. Coronary heart disease, also known as heart disease, has many conditions. High blood pressure happens when one blood pressure reading is 140/90 or more. Heart failure, aka congestive heart failure, doesn't mean that one's heart stops working. It means the heart has become weak and has a hard time pumping blood through the body. Stroke happens when a blood vessel in the brain suddenly gets blocked or ruptures. Although cardiovascular disease may sound frightening to some, being proactive and understanding the risk factors will help you feel in control. This is a chart for both men and women in Michigan. But even if the genders were split up, it would look similar, with heart disease being the leading cause. And here's Seth.
Hello. All right, so next is risk factors. A risk factor is a term used for traits or habits that make a person more likely to get heart disease. All right, so now that you know how the heart works, let's talk about what you can do to keep it working in tip-top shape. There are two types of risk factors. Those that are not modifiable, such as age, family history, gender, or race. However, there are those that are modifiable or those that are able to control, such as high blood pressure, cholesterol, cigarette smoking, diabetes, body mass index, and physical inactivity. Today we can focus on those risk factors that we can change. Are you at risk? The more risk factors you have, the greater risk you have of getting heart disease. It's best to speak with your doctor to see if you are at risk. Okay, now you need to know your numbers. These are national recommended guidelines. However, one should always check with your doctor, as numbers may vary from person to person. So we have blood pressure. The optimal blood pressure is 120/80. That means your systolic pressure, which is pressure when blood leaves the heart, is 120. Your diastolic is 80 when it leaves the heart. And pre-hypertension is systolic pressure or top pressure of 120 to 139. Diastolic is 80 to 89. And hypertension is more than 140 over 90. It's really not good. Eating less salt and sodium can help lower your blood pressure and prevent high blood pressure. Yes. Tip: spice your food instead of adding salt. Use spices and herbs to add more taste. Garlic powder instead of garlic salt, and salt is an acquired taste. The more you use, the more you want it. So it's best just not to eat much. Next we have cholesterol. Total cholesterol amount, you want less than 70. HDL, which is your good cholesterol, you want more than 60. Not too much, but just right. LDL, which is your bad cholesterol, you want under 100. And your triglycerides, you want less than 50. Eating low fat, low cholesterol foods will help reduce your blood pressure, your blood cholesterol level, and your weight, and prevent heart disease. Low-fat diets keep blood vessels from getting clogged. One small step you can take to lower fat is to take the skin off the chicken. Choose to broil, bake, or grill your chicken instead of frying. If you choose to fry, use olive oil instead of vegetable oil, as this has the good kind of cholesterol. Next is glucose. You want a normal glucose level is about 70 to 99 milligrams and pre-diabetes is 100 to 125 milligrams, and diabetes, which is not good, obviously, is 126 milligrams or more. And last is body mass index. It is a measurement to see your weight is a healthy range for your height. A BMI of 18 to 24 is just right. 25 to 29 is slightly overweight, and 30 or above, you're obese. So to get your BMI, you take your weight and divide it by your height, and then divide it by height again, and then times it by inches, and then times that by 703. A little complicated, but not too bad. So, yeah. Regular physical activity can help your heart work better, lower your blood pressure, blood cholesterol, lower your blood sugar, and help you control your appetite and weight. And I'll hand it off to Chris.
All right, prevention is the best medicine. To do prevention, know your numbers, healthy eating, increase physical activity, quit smoking. Healthy eating, limit unhealthy fats in your diet, limit your sugar intake, and watch portion sizes. Add some fruits and vegetables in your diet. Include good fats in your diet, such as fish, avocados, nuts, and olive oil. Try to get 25 to 30 grams of fiber a day. Physical activity. Work out for 30 minutes a day for about 5 days or more a week. Muscle strength training on 2 or more days. This can be done 10 minutes at a time. Always check with your doctor before beginning an exercise program. With strength training, 2 times a week that work all the major muscles: legs, hips, back, abdomen, chest, shoulders, and arms. Start slow. Use stairs instead of the elevator. Farther away. Increase your activity. Walk, rake leaves, dance. Increase your active level even more. Run, swim, bicycle, jog. Demonstrate 2-minute walk, play music. Smoking. If you smoke, consider quitting. Cutting down is not enough. When you smoke, there's benefits of quitting. 20 minutes, your blood pressure and pulse rate return to normal. 8 hours, blood carbon monoxide levels drop. 24 hours, chance of heart attack decrease. 48 hours, nerve endings start to regrow. 72 hours, breathing becomes easier and energy level increases. Within 1 year, risk of getting coronary heart disease is half that of a current smoker. Now I'm going to hand it off to Maria.
Do you know the warning signs of heart attack or stroke? If you are experiencing aching, pressure, tightness or chest discomfort, cold sweats, nausea, or pain in the jaw, neck, shoulder, or arm, you may be having a heart attack. If you or someone you know is having a heart attack, dial 111 immediately. Don't wait. Warning signs of a stroke are different than those of a heart attack. Just remember, smile, reach, and speech. For example, if someone you know is having a stroke, he or she may not be able to smile, or the smile may be lopsided or droopy to one side. Ask the person to reach both arms in front of them. If one arm droops or he or she is not able to hold their arm in position, this is also a warning sign of a stroke. Ask the person to repeat a simple phrase, such as, "The early bird catches the worm." When a person is having a stroke, they are more likely to have mental confusion. Therefore, speech may be abnormal. Remember, a stroke is no joke. If you or someone you know is having a stroke, make sure you call 911 immediately. Remember, a heart attack and a stroke are medical emergencies. Call 911. Get to the hospital right away. If you or someone you know is having warning signs of a heart attack or stroke, don't delay. Call 911 immediately. Don't wait, don't drive, stay alive. Again, call 911 immediately. The sooner you receive treatment for a heart attack or stroke, the better the chances of our recovery. Remember, cardiovascular disease affects the heart, the blood vessels, and their function. Maintaining a healthy heart begins with minimizing your risk factors. Knowing your numbers, such as tests of cholesterol, blood pressure, and body mass index, can equip you with the knowledge you need to make healthy choices. Getting to the heart of the matter was brought to you by your GRCC students.